Okay, hello everyone. I'm aware it's very close to lunch and you're probably all getting quite stressed. And you probably all need to go to the toilet and you need to eat. So I'll be as brief as I can. Some colleagues in this room have worked with me before. I hope that doesn't represent me on a Monday morning, but I think maybe sometimes it does. But stress is becoming a bigger and bigger problem. We've heard lots this morning about some of the issues that the surveys have recently brought up, and I'm not going to repeat it all because you've heard most of this already, but some of the statistics are quite shocking. 94% working harder than last year, and 86% said morale had worsened. We've heard from Richard and Nigel about the National GP Work-Life Survey, which was run by the University of Manchester, been running for a long time. I think the interesting one for me in terms of stress is actually bullet point 3, which says that actually where we get least stressed is from interruptions during emergency calls during surgery. And the point I would make for that is that that's about stress is a reaction to something. And there are lots of factors that come into play that make you stressed. And it isn't the obvious thing, because lots of people would look and think that would be our most stressful thing to happen. Actually, it isn't, because we feel we've got resources to do it, because we might value the activity more. So stress is a complex thing. The last one, of course, we've heard from Richard, and it is quite worrying. More stuff here. I think again, 95% reporting working very intensively, 84% reported working very fast. Well, what about the quality issues of all of that? Is that sustainable? And this one is really worrying for me. 39% increase in GPs expecting to quit direct patient care in the next 5 years. But that's in the under 50-year group. So those are our potential leaders. Those are the people who will be taking forward whatever changes we've talked about this morning, and yet we've got a 39% increase of saying they want to quit patient care. So that's a really, really worrying statistic, which again hasn't really been picked up by the media, as you've already heard. So what's our experience? Well, we're starting to see increasing numbers of GPs and practice managers suffering with stress. We're starting to see more partnership problems. We're starting to see more performance issues. And we're certainly seeing more signs of burnout. And I think you may have seen in the GP press in Pulse a figure of 54% of GPs who completed their online survey showing significant signs of burnout. And burnout is very different to stress. It's a very different phenomenon. And that's a very, very worrying statistic. Now, we can argue about surveys. You can question the validity. But the absolute trend is clear. So just for a couple of minutes, I want to answer that question, really, which was, is this all predictable? My contention is that it was very predictable. I don't know whether any of you have heard of the Whitehall 2 study, which has been running since 1985. It's a major piece of research, currently still being researched, still going on at University College London. Ironically, it looks at stress in civil servants based in Whitehall, hence the title. But it comes up with a very clear message that stress in the workplace increases the risk of disease and ill health, particularly coronary artery disease and mental health issues. So what are its key risk factors? The first one, an imbalance between the psychological demands of work and the degree of control over the work, and the combination of a high demand and low control being toxic. And low control is particularly important. Well, I think this is why QOF and the contract imposition and the changes that that's brought in is having such a fundamental effect on the way that we perceive our work. Social support. GPs tied to computers. That's a big problem in my practice. That I used to see people for coffee, I now struggle to see people. I often don't see one of my partners all day long, unless I actively go and look them out. And it's a real problem. The study has shown that lack of loss or low social support in work is a major risk factor for depression. Effort-reward imbalance. Increasing effort for reduced reward. Well, QOF thresholds. It's an obvious one. Job security. Job security. Secure jobs are good for your health. Less secure jobs are bad for your health. So this is why this continual organisational change and the insecurity that brings will have real health consequences on any workforce, not just general practice, not just the health service generally. And poorly managed organisational change, SBS. That's one for the practice managers. How stressed have you been over SBS? So what helps? There are some things that helps, and they're actually fairly obvious, but they're things that we don't do very well. Healthy living, usually the first casualty to stress as we resort to junk food, alcohol, not exercising, missing meals, having affairs, all the things that we don't do. Number one. Number two. Maybe too active. Casualty number two, just too knackered to bother going out. Can't be bothered. Meeting friends, can't be bothered to pick up the phone because you're too tired at the end of the day. And I'm sure we all recognise that. And then one of the other protective factors is a very difficult thing, which is managing and balancing your work and family demands. If they get out of kilter, it's bad for you. If you can keep them on a level, it's actually protective. So what are we doing about it? Well, first thing is we're waking up to the problem. We're looking to develop a program to support. I've written some web pages which are on the website. They went on the website a couple of weeks ago. They're very general, just to give some people some resources, just to provoke some conversations. There are some interesting videos which you might want to watch on there. We signpost to other services. There's the BMA counselling, there's the Doctor for Doctor support service. In Wiltshire, there is a stress line, which was set up by the PCT many years ago, which actually I've discovered was recommissioned in February 2013 in their sort of last act for another 2 years. Unfortunately, it's not used very much. So even if resources are out there, we're not very good at using them. So we signpost to other services. Wessex Insight, as you know, is ongoing, and we try to link to the deaneries. In particular, the Severn Deanery, which covers Wiltshire, Swindon, have set up something called a practitioner support unit and a series of network of mentors, which we're trying to engage with them actively. So what's the next step? Well, we're discussing it really, and that's the purpose for taking 10 minutes of your time now just to bring it to your attention, because we're open to ideas. Some of the things we might look at is developing a network of mentors ourselves. Obviously, there's resource implications in that and training, so that's something that we might look to develop. We're also discussing the possibility of stress management workshops and bringing in some external resources to run stress management workshops, and that might be looking at stress at individual levels. We don't really want to see people who are ill or burnt out because that's a health issue, but actually helping people manage stress in a much more proactive way rather than waiting till it's a disaster. This is an interesting one. How do you manage stress at an organisational level? How many of you realise that stress is a responsibility for you at organisational level to manage under the Health and Safety at Work Act? How many of us are actually doing anything? So there's a training issue there maybe aimed at practice managers about how you look at what you can do in your organisation to identify and manage the problem. Mindfulness. I don't know much about mindfulness, but we need to think out of the box. There are other things, other activities, other issues, other things that are going on which might help us rather than sticking to our traditional medical model. And any ideas, please contact me. That's my that's my Wessex LMC email address. If you use Twitter, then you can follow me. And that's my mobile phone number. Can any suggestions be positive, please? Because I don't want to get more stressed. And I've rushed through this because it's lunchtime, so have a think about it. Please have a look at the web pages on the website, which are easy to find. They're in the guidance section in a separate section. And any suggestions, we'd be happy to hear. Thank you.